as I was discussing about dopamine, and here a question arises that what I feel if I have a low dopamine level, like what are the symptoms if a person have low level of dopamine in the body. Uh, they might feel tired, unmotivated, and unhappy, just opposite to the person having the right amount of dopamine. And the person may also have memory loss, mood swings, sleep problems like insomnia, and concentration problems on any of the topic. How might I feel I have a high dopamine level? If a person have a high dopamine level, he might feel euphoric and energized. The negative side of having high level of dopamine includes having trouble in sleeping, being more aggressive, and poor impulse control. Diseases that are associated with low level of dopamine. A very famous disease, and also a very common disease as well, Parkinson's disease. It's a brain disorder that causes unintended or uncontrollable movements such as shaking, stiffness, and difficulty with balance and coordination. Symptoms usually begin gradually and get worse over time. Restless leg syndrome, RLS, also known as Willis-Ekbom disease. Primarily, RLS and idiopathic RLS is a neurological disorder that causes unpleasant sensations in the legs and an irresistible urge to move them. I have also mentioned the link over here, and you can also get to know about some other diseases related to uh, low level of dopamine. Diseases associated with the high level of dopamine mania, having an abnormally high level of activity or energy, feeling extremely happy or excited, not sleeping or only getting a few hours of sleeping, but still feeling rested, having inflated self-esteem, thinking that you are invincible. These are all the symptoms that you have a high level of dopamine, and basically it is considered as a disease because it is affecting to your body, but due to the high level of dopamine, the person is not be able to feel that. The second one is obesity, that is most common, and the presence of extra fats in the human body uh, is also a form of disease that is caused by high level of dopamine. Now, some diseases that are associated with both high and low level of dopamine, that is schizophrenia, refers to a condition and to a spectrum of disorders that all involve a disconnection from reality, including hallucinations and delusions. It affects a person's ability to recognize symptoms that they have of this condition. It's a severe condition, but it is treatable, and many people with it can still live happy for their lives. But there are always some type of precautions that they have to take along with it. Some symptoms of this disease can possibly be caused by having too much dopamine in certain areas of brain. Other symptoms are possibly caused by not having enough dopamine in certain areas of brain as well. Lack of motivation is something we can link with this type of disease. I have also mentioned the link over here, and you can um, go through some more information about this disease from this site. Now, how can I improve my dopamine level in a natural way? There are many remedies that are naturally helpful for increasing dopamine. Further research is needed on the effects of food and neurotransmitters such as dopamine. Eat a diet that is high in magnesium and tyrosine-rich foods, like those foods uh, which have the amino acids which our body cannot make naturally, and we have to take from resources. Tyrosine is an amino acid. It's absorbed in our body and then goes to our brain when it's converted into dopamine. Foods like chicken, almonds, apples, avocados, banana, beets, chocolate, green leafy vegetables like spinach, and green tea, oranges, peas, like all these are food as a source of uh, increasing dopamine in a natural way. But apart from the diet, there are also some activities through which we can increase our dopamine level in a natural way. And it is always better to go towards the natural process rather than using the medications. Engaging in activities that makes us happy or feel relaxed, like if somebody has hobbies that makes them feel good, uh, they should do that. Or if someone likes to do exercise, he must do exercise in order to make his body relax, calm, and if body gets relaxed and calm, the dopamine level will um, certainly come to the normal range. I have also mentioned the link over here from you can also see some more natural remedies that can increase the dopamine level in human body and some other information as well. So the role of dopamine in cognitive behavioral theory. In CBT, the goal to help individuals develop positive habits and behavior that support their mental health and well-being by reinforcing these behaviors through the release of dopamine. As dopamine is a feel-good hormone, so if the dopamine in the human body is at its normal level, it is um, a it is a sure thing that the person will have a positive thoughts and the positive behavior uh, with his personality and in surrounding as well. It is important to note that dopamine is just one of many neurotransmitters involved in mental health and well-being, and that the role of dopamine in CBT is still being studied. However, the reinforcement of positive behavior in the development of new habits is a key component of CBT, and dopamine is thought to be involved in this process. I mentioned a book over here so you can get some reference or some more details about medications. There are some medicines that I have mentioned over here that can severely increase the dopamine if a person having dopamine. Roll is a dopamine agonist medication used to treat Parkinson's disease and restless leg syndrome. Works by activation dopamine receptors in the brain, particularly the D2 and D3 receptor subtypes. The mechanism of action of this medication involves binding to dopamine 2 or D3 receptor. This medicine binds to and activates dopamine D2 and D3 receptor in the brain. This activates dopamine signaling pathways and mimics the effect of naturally produced dopamine. Increasing dopamine neurotransmission by activating dopamine receptor. This medication increases dopamine neurotransmission, especially in the motor neurons pathway involved in behavior control and correlation. Some other mechanism like dopamine role may also modulate the neurotransmitter system to some extent, such as reducing glutamate transmission, but the major mechanism involves targeting dopamine receptors and improving dopamine transmission in the brain. Telemedicine is pramipixole. It's a medication that belongs to a class of drugs called dopamine agonists. It's used to treat Parkinson's disease and RLS syndrome, but both of which are characterized by deficiency or dysfunction in the dopamine system. This mechanism of action involves the activate dopamine receptor in the brain and mimicking the effects of dopamine. The exact mechanism by which this medicine activates dopamine receptor is not fully understood, but it is believed to involve its ability to bind a specific site of the receptor called a noise binding site. By binding to site, this medicine is able to activate the receptor and initiate a signal cascade that leads to an increase in dopamine transmission. And like in case of serotonin, same in the case of dopamine, there are these medications are effective but have some side effects as well. This dizziness, nausea, loss of balance, uh, difficulty in remembering abnormal dreams and heartburn, etc. For some more information about this type of medicine and the concerning side effects and mechanism of action, visit this link and get some more information. The third medicine that I have mentioned in my presentation topic is levodopa. It is a medication that is used to treat symptoms of Parkinson's disease again, and the mechanism of action of this medicine involves conversion into dopamine. It can be activated dopamine receptors and alleviate the symptom of Parkinson's disease. So talking towards the theories of CBT. Actually, CBT have been broken into three types of theories. The number one is the cognitive model. Cognitive model describe how people's thoughts and perception influence the way they feel and behave. The cognitive model is at the core of CBT and it plays a vital and critical role in helping therapists conceptualize and treat their clients' difficulties. It is a theoretical framework that analyzes the practice of CBT, the cognitive model process that our thoughts, feelings, and behaviors are all interconnected, and then negative thoughts and beliefs can lead to negative emotions, behaviors that ultimately causes lack of confidence, uh, demotivation, and that is surely caused due to low level of serotonin and dopamine. According to the cognitive model, individuals develop negative thought patterns as a result of their past experiences and beliefs, and um, they don't believe so easily on others after the past experiences, and they think that the whole environment is around them is they make the whole picture of their environment as a negative picture and are always in a state of depression, anxiety. These negative thoughts can then trigger negative emotions such as depression, anxiety, as I have discussed, and maladaptive behaviors such as avoidance and substance use and aggression. Like these people like to then avoid people and remain to be, um, and likes to remain alone and or aggressive sometimes. If we talk about the overall of this model, the cognitive model provides comprehensive framework for understanding interplay between thought, feeling, behavior, and provides roadmap for helping people to gain and thought. I've also mentioned the link and some sources of the books from where you can read more about this model. The next model is the behavioral model, in which this is often used in conjunction with the cognitive model, where emphasizing the role of thought in psychological problems. Together, they provide a comprehensive framework for understanding and interplay between behavior, thoughts, and emotions. The behavior model proposes that behavior is learned through a process of conditioning. Positive behavior are reinforced by positive consequences, such as reward, praise, while negative behaviors are punished or ignored. Over time, individuals build repeat behaviors that are reinforced and avoid behaviors that are punished or ignored. Overall, the behavior model of CBT provides a useful framework for understanding the role of behavior in psychological problems and provides a roadmap for helping individuals change maladaptive behavior patterns and improve their mental health and well-being. Like in this model, um, The therapist mostly try to change the environment around the person that is facing mental illness, and they make that person to live with other people having positive attitude and positive behavior, so that those that people or that environment might influence on these on person affected with self mental illness. The next one is the CBT model, cognitive behavioral model. It suggests that individuals develop negative thought patterns as a result of their past experiences and the belief that they hold about themselves, others, and the world around them. The negative thoughts can trigger negative emotions such as depression, anxiety, as I discussed earlier. Like in theory, main goal is to identify and challenge these negative thoughts patterns through a process of cognitive restructuring. It then involves identifying and challenging negative thoughts and beliefs, replacing them with more accurate and realistic ones. The process aims to change the way individuals think about themselves, others, and the world around them. The behavioral component of CBT is emphasized in this model. The behavioral component involves identifying and monitoring behaviors and developing strategies to change them. I've also mentioned some sources of books as well as link that you can uh, go and have a look at this type of theory with more.